Frontline workers, including grocery clerks, cleaners, nurses, and shelter employees, all are stressed out right now. They're also very worried about catching and transmitting COVID-19. They're demanding better job protection, more pay, and guaranteed paid sick days, not just now, but going forward. Here to give us some insight is registered nurse and coordinator of the Decent Work and Health Network, Carolina Jimenez. Carolina, thank you very much for joining us this morning.
Thanks, Roger.
Now, when people think of frontline workers, they think of nurses, doctors, but also the essential workers include a lot of people that barely scrape by at the best of times, and you'd like to see better protection. Who are those people, and what are you asking for?
Absolutely. So these are folks who are in our grocery stores. There are garbage collectors, delivery drivers, bike couriers, community workers, cleaners, and so many more who are the backbone of our society as we live in today. And we are concerned as a medical community, the Decent Work and Health Network, that these essential workers do not have essential protections like paid sick days. So we have been demanding from the provincial government to have paid sick day implemented. We are asking for 7 permanent days of paid sick leave, plus an additional 14 during pandemics like the ones we're seeing now. It is true that these, that workers can access the Canadian Emergency Response Benefit as an income support if you do need to self-isolate. But the problem with that is that you need to be without income for 14 days. And as a health provider, our medical advice is if you are having symptoms, you need to stay at home today. These essential workers do not have the luxury of waiting 14 days. And I mean, quite frankly, I'm shocked, right? We're seeing the tragedies in the long-term care homes and personal support workers, long-term care workers. The cleaners of these facilities don't have paid sick days.
And do you feel that would have made a difference if they knew they had the ability to stay home and still get paid? That might have limited what's been unfolding in long-term care facilities?
Yeah, absolutely. And I'll tell you a story. So one of the family physicians that I work with in the Decent Work and Health Network, one of his patients is a cleaner. And this cleaner, in order to just, pay her bills at the end of the month, has to have multiple different types of jobs. And he was telling me that he knows that even if she feels sick, she's going to work anyway, because she has to pay her bill. So this is exactly the type of position that workers are in. Essential workers are heroes that we're calling them. They have no protection. So that's why we need the 7 permanent days plus an additional 14 days. And if we would have had this at the outset of the pandemic, you can only imagine, right? This is lives that could have been still here today.
Are you optimistic that this, we've talked about them as heroes, are you optimistic this will continue once the memories of the pandemic fade?
I am feeling concerned because the measures that are in place are not enough. And we know this as a medical community. Quite frankly, it is shocking that actually in 2019, Premier Ford took away paid sick days, right? We had paid sick days and they were taken away. What is being done right now in the long-term care homes, ensuring that these workers have one employer, have more secure work, is a step in the right direction. But like we talked about earlier, this is, cleaners, this is delivery drivers, right? The Uber Eats couriers that I know so many of us get food from. That is a mechanism of, infectious disease transmission. And the Canadian Emergency Response Benefit is not enough. Because workers need to stay at home today, and the provincial government has not put in any other protections for all of these other types of essential workers.
Okay, Carolina, thank you very much for joining us this morning.
Thank you.